Hello everyone, my name is Larry Thomas and I am a nurse practitioner student at Auburn University, and today I will be discussing kidney stones. I will first do a brief overview of kidney stones, then discuss symptoms, risk factors, treatment, and prevention. Kidney stones are one of the most common disorders of the urinary tract. They are small, hard mineral deposits that form either in the kidney or the urinary tract itself. The stones are primarily made up of calcium and other acid salts. Kidney stones vary in size from a small stone that may pass through the urinary tract on its own to larger stones that require interventional therapy to be removed. Urolithiasis is the term used to describe stones that occur in the urinary tract, and nephrolithiasis is the term used to describe stones that occur in the kidney itself. So what symptoms are related to kidney stones? The number one symptom related to kidney stones is pain. The pain is usually located in the flank area and can travel to the abdominal area, into the groin, and actually even into the genitals. This pain can be associated with nausea and vomiting. This pain is intermittent, it comes and goes, and this pain typically is not made better by anything. Patients that typically present with kidney stone pain just simply cannot get comfortable. Blood may also be detected in the urine, either visibly seen or under a microscope with a urinalysis. So are there any risk factors to having kidney stones? Some of the risk factors included our family history, intestinal diseases and intestinal surgeries to include gastric bypass, gout, anatomical abnormalities, and even some medications that are used to treat seizures and migraines such as Topamax increase your risk of developing kidney stones. So how are kidney stones detected? The number one hallmark diagnostic test for kidney stones is a CT scan. Other methods can be used, such as an ultrasound, which is usually used to detect obstruction of the kidney itself. Plain abdominal x-ray films can be used for follow-up diagnostic testing, typically after a surgery or some kind of interventional therapy, to make sure that the kidney stones have been completely removed. This is a good way to reduce the amount of radiation that a patient receives with respect to the treatment of the kidney stone itself. So what treatment options are available to have kidney stones removed? Treatment options include medication therapy, shockwave lithotripsy, laser lithotripsy, and even percutaneous nephrolithotomy. Obviously, medication therapy would be the first choice if the stone is determined to be small enough that the patient can pass it on their own. Medications like Flomax can be used to dilate the urinary tract to assist the stone in passing through the urinary tract on its own. If the CT scan reveals the kidney stone to be too large for the patient to pass on their own, then either shockwave lithotripsy or laser lithotripsy are discussed as a first line intervention to have the kidney stone reduced in size that it can be passed through the urinary tract. The last intervention would be the percutaneous nephrolithotomy, where a small incision is made in the back where the kidney is. A tool is placed, the kidney stone is broken up and sucked out for the kidney stone to be removed that way. Is there any way to prevent kidney stones? Typically, prevention is not even discussed until after a patient is diagnosed with their first kidney stone. Some people just simply don't even think about kidney stones until they get one. Some prevention measures include dietary restrictions, such as limiting sodium intake, drinking more water, lemonade, because lemonade actually has citrate in it, which inhibits the formation of kidney stones, and limiting sodium and animal protein intake. All these are prevention measures that can help with reducing your risks of either having a kidney stone recur if you've already had one, or if you're at high risk either with family history or intestinal disease or gout or taking medications for seizures or migraines. These preventative measures can actually reduce the risk of you developing a kidney stone, period. I hope this material helped everyone. Have a good day, and War Eagle.